Today, we're going to be talking about a very crucial but often neglected factor that impacts girl education. We're going to put the focus on lack of access to menstrual health solutions. And for that, we have with us Aradhana Rai Gupta. Aradhana's passion for community work led her to co-found Project Bala. Her work on sustainability leadership at the University of Cambridge, where she worked with large organizations and helped them to bring about sustainable change and development, brings in valuable expertise to the project. Welcome to Chalk Talk, Aradhana. We're really looking forward to delving deeper into this topic.
Thank you so much for having me.
So, you work in the area of menstrual hygiene. Tell us more about your work.
Of course. So, I went over your last few podcasts which spoke about the intersection of education with different aspects of learning. And one thing I realized, and I'm grateful to be here and talk about it, is that there's always a miss between education and menstrual health. We often don't give the importance that it's required in a girl's early years. And that's why we started Project Bala. In fact, my co-founder and I realized that we were volunteering in schools and we would often see girls not attending schools a few days of the month. And we came up with a three-pronged solution to tackle problems relating to menstrual hygiene, which span education, environment, health, and livelihood. This three-pronged solution includes an awareness module, which we've built in conversation with over 25,000 women and girls from across the country. It covers 7 different topics, right from what is menstruation, what is the biological process behind it, to when to visit a doctor, how to manage your period pain effectively without there being any additional cost to the household. Also, we've infused it with elements of storytelling, theater, poetry, so that there's higher engagement and retention for this. We don't only focus on young girls and women to talk about this topic. We realize men are an important part of the conversation, and we've come up with a module just for boys or men in menstruation so that they can be better allies. The second part of our solution is a very innovative reusable sanitary napkin that we've built over 3 years. We worked with women in Haryana and Rajasthan to come up with this product, and it works very well in areas where there is affordability issues and access issues for menstrual absorbance. It is a 2-year reusable sanitary napkin. That means a woman doesn't need to go to a shop to buy any sort of menstrual absorbent for those 2 years. And we've seen a 90% uptake for this product. That means after 2 years, 90% of the women want to purchase this product again. And the last is our livelihood model, which we came up with 2 years back to sort of close the demand loop that we've created by building awareness around the product. When we go into a community to implement our solution, we make it a point to assign, local men and women to become resource people and sales people of the product. So they not only earn a margin on each product that they sell, but they're also able to ensure a continuous supply of the product. And in the last 5 years, we worked with over 7 lakh women now. Each woman brings her own context and perspective to this topic, and we feel each context and perspective sort of fuels our passion to work harder for the cause.
That's some really interesting work that you're doing, Aradhana. I was wondering, most of your work is focused in rural areas, right?
Yeah.
So what have you found during your work? Do you find that lack of access to menstrual health products impacts learning outcomes for girls?
Yes, definitely. I mean, secondary data in fact shows us, and this is a little outdated, but 71% of girls didn't know about what periods are up until they hit puberty or they got their first period. In fact, I also didn't know what periods were up until I got my first period, and I went to my mom and told her, what is this? And she just handed a pad over to me but never told me the biological process behind it. This is secondary data. Another popular stat that we talk about is 1 out of every 5 girls drop out of school every year because they're not able to manage their periods effectively. Even though this is all secondary data, through our own experiences on ground, we found that girls do end up missing school, and this directly impacts attendance. This directly impacts participation in schools, and they don't feel like doing any sort of physical activity. So most often than not in rural areas, we see that only boys are playing the sports. Even if a girl is not on her period, she would not want to engage in any sort of physical activity because we've realized menstrual education in early years of childhood form the basis of self-confidence for years to come. There's this interesting analogy I read somewhere that spoke about how, when a child loses their tooth, a tooth fairy will come, and there's sort of like a positive reinforcement for almost like a gap in your mouth, right? But that's not the case with periods. We are taught that it's something to be hush-hush about, to be tabooed about, and that sort of makes us low on self-confidence, low on self-esteem. And we've actually taken surveys to notice the difference between women attending a workshop, what was their self-confidence before, how much do they want to participate in activities, as opposed to when they've attended the workshop, do they feel empowered? Do they feel empowered enough to come to school? So that is the self-confidence piece, but also, lack of infrastructure in schools forms a very, very important aspect of learning outcomes, I feel. If a girl is not able to change her pad effectively, she would not want to come to school, right? If you can't change your pad for 7 to 8 hours, if your teacher doesn't know how to handle your period because you're just in the 7th, 8th grade, that will impact you coming to school. So these are some of the aspects that we've seen, not only in rural areas, but also in urban areas.
So between, a mindset and maybe access to a product, which of the two do you think makes a larger impact, or you think has a larger gap? I mean, do you think we need to change the mindset more than anything else?
It goes hand in hand, of course, but step one is the mindset. If you don't approach the topic in a positive manner, it's going to have an impact on the kind of products you use. So let's say, when we get our first period, if we don't know the biological process behind it, or if we are not educated enough, if we don't know what a normal or an abnormal period looks like, it is going to have an impact on the product that we use, which we've seen in rural areas. There is a lot of intergenerational myths and taboos that are, passed on from your dadi, nani, your mom, and then you. You end up using a ghar ka kapda, which is not hygienic in any way. You don't end up using a safe form of menstrual absorbent such as a menstrual cup, because there is taboo around there being insertion issues. You lose your virginity if you insert a tampon or a menstrual cup, which is not true. But if there's no education around that topic, it is going to impact your product choice.
Also, something like this would have long-term impacts, not just for the girl, but also for the nation as a whole, because effectively what you're doing is you're reducing educational access to 50% of the population. You're also limiting the skills that they learn, maybe their employability in the future. And at a very macro level, that would impact the output of the nations.
Yeah.
So it can actually be a pretty grave concern. So what do you think can be done to rectify the situation?
Menstrual, health has a quadruple effect on education, health, environment, and livelihood. So livelihood and environment, which are macro factors, are huge pieces of this. And if we don't concentrate on those, it is going to impact education as well, right? So what we've figured, and if we talk about early education or early years of puberty, what can be done? I think 3 things that can be concentrated on. One is education pre-puberty. So a lot of times, even in schools in urban areas, we're given a workshop when we've hit puberty in 7th or 8th grade. Some big company will come talk about their pads, and that's about it. And then we get sexual and reproductive health probably in 9th or 10th grade, when we've all learnt about those kind of things. So pre-puberty education is becoming more and more relevant and important now. In addition to that, building social capital around a girl. So equipping teachers with the correct knowledge, equipping mothers with the correct knowledge, because those are your immediate touch points at the ages of 10, 11, 12, right? So education is a huge piece, and building the correct capacity in the correct areas. Second, I would say, is not to just distribute sanitary napkins, is to present a basket of product choices. Letting a woman or a young girl know that there is more to products than just a disposable sanitary napkin. There are cloth pads that can be used, there are menstrual cups that can be used, there are tampons that can be used. So she doesn't just have to depend, frankly, on a solution that is detrimental to the environment and to herself as well. And the third is building infrastructure. In rural areas, there is still a problem of gendered toilets. Thankfully, in urban areas or in metropolitan cities, we have gendered toilets now, but that is not enough. We have to look at aspects of privacy, safety, giving them safe water, clean water, soap. All those things are very, very important to have like a holistic, positive experience for this.
So, do you think this is a task that could be left solely to the government, or do you need more private participation here?
I think a lot more private participation. Government, thankfully there are a lot of schemes now, especially in areas that we work in. For example, in Rajasthan, you have the Udan scheme, which distributes free sanitary napkins, disposable sanitary napkins. They are low quality, low cost, but at least the awareness is there. I feel the government is doing their bit, but private participation will only fuel that growth, right? If you're educating the right participants, if you're educating the right stakeholders, that is not going to come from the government, especially in private schools, especially in workspaces, building more positive, period positive communities. I think a lot of private participation can be seen in those areas.
Thank you so much, Aradhana. You're doing some really good work, and we wish you the very best.
Thank you so much. Thank you.
I hope our viewers gained some valuable insights from that interaction. If you did, please remember to subscribe to our channel. Thank you so much. See you next time.